Hello, everybody. Um, my name is Karim Kalache. I am talking to you from Doha in Qatar, where I live and where I work as well. Um, I'm very looking forward to attend the course Fetal Examination Navigating the Future in October, on the 12th of October in Bucharest, together with Professor Rabi Shawi from Berlin and Professor Oliver Kagan from Tübingen, both very, very good friends from long time. And I will be giving 3 lectures at the course. And so the first lecture will be on early pregnancy between miscarriage and viability. And I'm sure everybody is very, very familiar with the first trimester ultrasound that is usually performed after 11, 12 weeks, 13 weeks. But what I and why the topic was added, what we realized is that many times colleagues struggle a little bit with ultrasounds done very early. Very early means maybe at 6, 7, 8, 9, below 10 weeks, and to take decisions regarding the management. So the lecture will be on early pregnancy between miscarriage and viability. And of course, to try, to get familiar with the ultrasound appearance of a normal early pregnancy, to recognize the most common complications below or before 10 weeks, and also to review the ultrasound criteria for a non-viable pregnancy and all the semiology, and to be really, really familiar with those ultrasound signs, because it's a scenario that we'll see quite frequently, and the whole management is dependent on the very, very precise ultrasound diagnosis. So that will be the first lecture. The second lecture will be on fetal brain ultrasound. And here, the focus will be on what has been introduced in the 90s or late 90s with the lateral ventricle width measurements. And if it's above 10 or 12 millimeter, I'm sure everybody's familiar with this concept, then it's a sign of a brain anomaly. But what we realized over the years is that it's not really the major changes that will indicate a major anomaly, but it's sometimes for the brain, very subtle, minor deviation from the normal that will be associated with a very, very severe brain anomaly. So that will be the second lecture, focus on the subtle change, what to look for, and how to be able to suspect or diagnose a major brain anomaly. And then, of course, MRI will help, and other imaging modalities. So the last lecture will be on the fetal gastrointestinal tract. Sounds a little bit simple. Everybody knows esophageal atresia will be polyhydramnios, duodenal atresia will be polyhydramnios, but the lower you navigate the gastrointestinal tract and the more complicated it becomes. Small bowel atresia, meconium peritonitis, anal atresia. So we will try to cover the whole topic in 20 minutes. And this lecture is really, really important, I think, because of course, as all the lectures during the conference, but because for this lecture, it is about the high morbidity of gastrointestinal tract anomaly. So there are some signs that will indicate imminent fetal death, and you need to be aware of them, and you need to understand how it happened, how a gastrointestinal anomaly can basically kill a fetus, unfortunately, and how we can react in time. So I'm really looking forward to see you in Bucharest. And I think it will be a nice conference because, of course, what Rabbi Shawi has done, he chose the 2 other lecturer that will help him, Oliver Kagan and myself, because we are really, really good friends, and there is a good chemistry between us. And I hope you will feeling during the course. And I think that's always the most important, to enjoy and to be able, to ask questions and to those, or exchange experience with those who have practiced ultrasound in obstetric and fetal medicine full time for many, 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 many years. Yeah, that's it. And see you soon in Bucharest.